This webinar is being recorded, so that means that you're going to get a copy of this recording along with the PowerPoint and any resources that any of our panelists will share. My name is Gina Platanino. I'm the SNAP Deputy Director here at FRAC, and we are so glad that you are taking the time to join us today for what promises to be a very enlightening, very resourceful panel. And I'm also very grateful to all of our panelists who are joining us as we discuss things at a very pivotal time. It's a very pivotal time because since the beginning of the year, we have been talking about the hunger cliff. And what does this mean, right? So the hunger cliff, in the term that FRAC has been utilizing it and other advocates, it means that individuals have been receiving these emergency allotments added to their benefits. So people were getting the maximum amount. So if you're a household of one, you were getting 281, you know, and it increased by the number of households. During December and the omnibus, it was signed, and individuals, part of that was that individuals would lose their emergency allotments at the end of January for some individuals, at the end of February for others. And one of those pockets of categories who will be impacted the most is our older adults. And in SNAP land, that means that anyone who is over 60. And one of the reasons that they are impacted the most is because of the way that SNAP works. SNAP works is it's a math calculation number. It works simply by, you know, you have to meet certain requirements. You have your benefits, you have the income, and you have expenses. Expenses in SNAP land translate into deductions. You know, how do you take away from those deductions? And how do you lower down your income? And that calculation equals our SNAP math. For many older adults, they are on a fixed income because they're usually getting Social Security and so on. And so the way that it works is that because of the way the Social Security is, and because they don't have that many deductions that other SNAP participants may be able to get, they go to the minimum. And in the majority of states, at the federal level at least, our SNAP benefit is set at 23. There are other states who have a higher SNAP benefit because they do it through the state. You know, New Jersey just passed legislation that now $95. We know that Maryland is $30 and Hawaii is just a little bit higher. But for the majority of the population, for older adults, they will go back to $23. And I know here at FRAC, we have already received some emails from individuals who say, I'm already struggling. How do I pay for medicine and my copays and my food that I need at $23? Because even though this is the Supplemental Nutrition Assistance Program, in reality, many individuals, this is it. This is how they utilize this as it all. So today we'll be talking about the medical expense deduction. And this is a deduction that you can take, as I was talking about the SNAP math, that allows eligible households to ensure they're receiving the adequate SNAP benefit amounts, right? And so you can claim out-of-pocket, non-reimbursed healthcare expenses. And I also want to make sure that individuals know that even though we're talking about older adults, it's also individuals who have a disability, and that also includes children, right? So I want to flag that we just don't think like, oh, older adults. It's also people with disabilities, but that also may include children. And that for SNAP plan, an older adult begins at. Next slide, please. And so, we were just told that the slideshow is not being shared by presentation. So you see the web browser. Okay, so I can tell you that we had a very nice slide telling you the information about the medical expense deduction, which you will get at the end of the week via PDF. And while we figure that part out, I'm going to tell you how this works before I turn it to my panelists. So that the way that this works is that the household member must have at least $35 a month in unreimbursed medical costs to be able to claim this deduction. Okay, I can see that. People can see it now. Wonderful. Thank you, David. And so once that older adult or individual claims it, then the SNAP state agency will recalculate their SNAP benefit and include a standard medical expense deduction of $155 a month. There are some individuals who have just so many medical expenses, and I'll flag dental. I remember when I used to work with clients, Medicare doesn't really cover dental. So people who had like a lot of dental issues, that's where the big high item bills came in. So I'll flag that for folks. So if the household member has over 190, thank you, Laura, for that, has over $190 a month in verified expenses, then you can claim actual expenses. And so one of the reasons we're here today is because this is an issue that we want to make sure that as we talk about the hunger cliff, that we ensure that people talk about benefit adequacy. And the second part, so that you can learn from other organizations that are working on this issue. Our first panelist is Jackie from AARP. She helps manage the foundation. And she's going to tell us, because a lot of people don't think like, oh, AARP and SNAP, they deeply care about older adults and ensuring that they have the resources that they need. And Stephen, if we can go to the presenter slide, so people can see their names, that would be helpful. Thank you. And so she will be sharing some of the work that AARP is doing in terms of outreach. Jackie will be followed by Brittany Mangini, who's the Associate Commissioner of Food Security and Nutrition Programs at the Massachusetts Department of Transitional Assistance. And I know I'm so proud to have Massachusetts here on, because they really are leading the way in trying to make things more accessible. It's not always easy, but for the client base. So we're going to hear from Brittany of what the state agency is doing to ensure benefit adequacy for older adults and those with a disability. And then we'll finish it off with Amy Dearlam, who is the CalFresh Outreach Director from River City Food Bank. And one of the reasons we invited Amy on is because California has done amazing work in enrolling older adults. There are many barriers that face older adults, and her particular group has been incredibly active and successful, and she's going to be sharing those methods. At the end, I will invite all our panelists to come in, and I ask that throughout our webinar that you can go ahead and start asking questions, and I will go and make sure that our panelists are answering them. So without further ado, one more thing, if we can go to the last bill, the last slide for me, thank you. One of the things that we need to keep in mind is that SNAP is a federal program, right? So with things happening at a federal level, it affects them, and some of our farm bill priorities that will help sort of tackle this, so we don't have to push so much our clients, making sure that they have every single deduction, and even when they're claiming this deduction, their benefits not going to change. So there's a couple of farm bill priorities that FRAC has, and we will put it on our text and we'll follow up with it. But closing the meal gap will ensure that there will be benefit adequacy, that the benefit amounts will increase because they will base it on the low cost food plan instead of the thrifty food plan. Improving Access to Nutrition Act by Rep. Lee, which will end these harmful, terrible time limits for older adults without dependents. And there's already a bill number 1510, and we already have 40 House co-sponsors. So your action item to start off is make sure that as we get these bills and we send them over to you, you're contacting your delegation and saying, please sign on, because these federal initiatives will have a deep impact to make things more accessible for your client base. The EATS Act, introduced by Rep. Gomez, will include improve access for college students. We're going to have a webinar in the upcoming weeks as we discuss the dismantling of the public health emergency, so keep watch. The SNAP Plus Act, introduced by Rep. Rush, will permanently end the ban on hot prepared foods and SNAP, which is really helpful for our older adults, as it's easier sometimes to buy hot food than having to prepare it for themselves. The Lift the Bar Act by Rep. Jayapal, which will lift the 5-year residency bar to SNAP and other public benefits. And we are also supporting improving that SNAP access across tribal populations, including allowing SNAP participation for other populations as well. So we are thankful that you are here, and I'm going to turn it over to Jackie.
All right, thanks, Gina. Hi, everyone. My name is Jackie Budilov, and I'm a Senior Program Manager at AARP Foundation, focused on food and nutrition benefits. I'm excited that you all were able to join us today, and I want to start us with a quick overview of older adults' participation in SNAP. Next slide. But first, AARP Foundation. AARP Foundation is the charitable arm of AARP. Next slide. Our mission is to end senior poverty, and we serve adults aged 50 and over, regardless of AARP membership. That's important because as I go through my slides, just be wary that sometimes I will talk about people 50 and over and sometimes 60 and over. We know that there are more than 37 million older adults who are living in poverty or that are one life event away from slipping into it. We have a variety of programs and services to help older adults with low incomes, such as our tax aid program to help older adults file their taxes and maximize their returns, our workforce program to help older adults obtain high quality jobs, and our benefits access programs to help older adults enroll in programs that can help with their financial stability. Next slide. The benefits access team is focused on helping older adults achieve the essentials for good health, such as SNAP for food and the Medicare Savings Program for healthcare, helping older adults connect to benefits such as the Earned Income Tax Credit and paid family leave, and helping older adults manage their recurring costs of debt, such as student loan debt and other types of consumer debt. Next slide. So what do we know about older adult participation in SNAP? Until last year, we had seen that there were about 5 million adults 60 and over who were eligible for SNAP but not enrolled, or that means less than half who were eligible were enrolled in the program. Next slide. But last year, the AARP Public Policy Institute and Mathematica released new research looking at state-specific eligibility rules, such as broad-based categorical eligibility, and found that there are actually 16 million older adults who are eligible for SNAP and not enrolled. That means that there are 63% of adults over 50 who are eligible for SNAP and just not receiving their benefits. The participation rates are much lower for those who are over age 60. We know that of the 16 million eligible for SNAP and not enrolled, 14 million of them were over age 60. Next slide. So what do we know about these eligible but unenrolled older adults? First, we know that they are more likely to live with others. While nearly 3/4 of older SNAP participants live alone, nearly 70% of eligible but unenrolled older adults live in households with 2 or more people. Next slide. Most older eligible non-participants lived in households with incomes between 100 and 200% of the federal poverty level. However, a sizable minority of eligible older participants have very low income. Nearly 14% of eligible non-participants age 50 and over, or 2.1 million people, were estimated to have incomes at or below 50% of the federal poverty level. Next slide. Most eligible non-participants aged 50 and over would be eligible to receive the minimum monthly SNAP benefit, but more than 3 million would receive more than $200 per month. There's 1 in 5 eligible non-participants that would receive $200 or more a month, and 2.3 million of those would be eligible for more than $300 a month. Eligible non-participants ages 50 and over were more likely than those under age 50 to be missing out on potentially substantial SNAP benefits. Next slide. So knowing this, how will older adults be impacted by the end of the emergency allotments? Next slide. In 2019, the average SNAP benefit for a household with an adult 60 and over was $120. What's more, 1 in 5 households with an adult 60 and over received the minimum benefit. So knowing that emergency allotments for a household of 1 were over $280, older adults are in for substantial decreases in their SNAP benefits. Next slide. We also know that the medical expense deduction, which has the ability to increase SNAP benefit amounts, is incredibly underutilized. In 2019, just 15% of households with an adult over 60 received this deduction. And this varied widely between states, ranging from 4% in Maine and Washington, D.C. to 69% in the Virgin Islands. Next slide. And with that, I want to turn it over to our next panelists who can tell you a bit more about how we can help older adults claim this deduction.
Thank you, Jackie. I appreciate that, and a really interesting presentation. So yes, hi everybody. My name is Brittany Mangini. I'm the Associate Commissioner for Food Security and Nutrition Programs for the Massachusetts Department of Transitional Assistance, and I oversee the SNAP program. And I'm here to talk to you a little bit about what we at the state agency have done to support older adults receiving SNAP. And so one thing that I want to make clearly clear is our vision and goal in supporting our older adults is what we like to say, from soup to nuts, the whole thing. You can't access SNAP benefits if you can't even get on the program. And so I want to talk a little bit about our initial approach to supporting older adults. So if I can have you go to the next slide, please. One thing, one intentional move that we in Massachusetts made that I highly, highly recommend is that we created a separate SNAP application just for older adults. And we structured this application in a way that is conducive to supporting them, specifically large scale font, large block and space for writing, things of that nature. We worked really closely with our stakeholders and community partners to gain feedback on the modifications that we made to the separate application. And a couple other highlights is that we do have it translated in 13 languages. We feel quite strongly that translating things as much as possible into people's native languages increases access to the program, and also clearly outlining the steps of the application process, because it can be a little bit cumbersome. So we want to be transparent to folks right off the bat on what they can expect and what needs to happen to complete the application process in order to access the benefits. Next slide, please. A couple just other things that I wanted to highlight that really are great practices as it relates to the application is a screening box for assistance. And specifically, we wanted to highlight the authorized representative. We feel like this is a tool that can help older adults that isn't utilized very much. And a lot of times agencies, including us until we made this move, required a separate form for folks to fill out in order for an entity to serve as their authorized representative. And we have several categories. We have an authorized representative who can transact benefits for folks, so they can go out and go shopping formally for them, that they can conduct the certification process, the interview on their behalf. And then we have less formal helping options, including identifying a community partner or organization that you would be willing to have contacted to assist you through the application process, but maybe wouldn't be the best fit to provide ongoing support. And lastly, we included the release of information. This simple step makes a big difference in streamlining the application process for older adults. It can be very confusing. And so instead of requiring an extra step and an extra piece of paper, we put it right on the application, and it's proven really, really helpful. Beyond that, the other section you see on the slide here is screening for accommodations. So this allows our client assistance coordinators. We have case managers who are specifically designed to serve folks with disabilities and provide additional accommodations, such as reading notices over the phone, for example, or having them sent in large print. So this section right on the application screens for those types of accommodations right off the bat. Next slide, please. As my two friends before me spoke, we talked a little bit about medical expenses and how critical they are ensuring benefit accuracy. And so we want to make sure that we put right up front on the application what constitutes a medical expense. One thing that we found particularly helpful was clarifying that even if a bill is not paid, if somebody is obligated to pay it and it qualifies under the medical expenses, that they should notify us about that. Another way to streamline reporting medical expenses is to put a designated space on the application to report transportation costs. This can be really tricky. Obviously, the average person doesn't know about federal mileage reimbursement or things of that nature. And so what this does is it informs our case managers about the different transportation routes that people take to access different medical care. And so folks can take those to address points, for example, plop them into Google Maps, and we can generate the mileage on behalf of the client. It's a simple step that can really streamline and help folks claim a deduction that's often a bit challenging to claim. And then lastly, the information that is put on this form is really helpful in streamlining the certification interview. It prompts case managers to ask follow-up questions and make sure they're accurately and adequately screening for all medical expenses. Next page, please. Another step that the agency took that I strongly recommend is that we set up a separate office that specifically serves older adults called our Senior Assistance Office. This was set up back in 2018, and the goal of it really was to increase the number of folks who are receiving the medical expense deduction, referrals, and we, through some data analysis, identified really high rates of churn. What churn is when somebody has their case closed and subsequently comes on shortly after, indicating that they weren't fundamentally ineligible for the program, but rather closed because of administrative reasons. And that's not beneficial to the client. It's not beneficial to the agency. So it was an identified goal of ours to decrease churn rates and minimize disruption in access to benefits for older adults. A couple key highlights that came out when we set up this office. One is we partnered with our sister agency, the Executive Office of Elder Affairs, and we had them come out and do a specific training for folks on ways that they could identify elder abuse and the steps that they could take to report it. Medical expense screening can also be a little cumbersome and confusing. So we really kind of worked with this specific team on informed interviewing skills and how to, for example, if somebody's already at the max benefit, not to start screening them for medical expenses and having them submit documentation that's not ultimately going to make any difference in their benefit amount. So just some key things that we really wanted to highlight for this specialized group. One thing I hear often too is we at the agency transitioned to a more automated approach with our phone service, which means when people call, they have to press a series of prompts to reach a live worker. This office has a specialized phone number for people who are over the age of 60 to call directly, and they reach a live person right away. So there's no prompting, there's no authenticating, it just rings and a human answers it. And that has been really critical to serving this population. Next slide, please. I want to speak a little bit about the numbers that this office sees. In particular, it's staffed up, as you can see, with an assistant director, 9 supervisors, and 31 case managers. And for those who are not familiar with the model that we employ here in Massachusetts, we have a statewide model for service utilizing a first available worker. And what that means is that we don't have case managers with caseloads, but rather any person who answers the phone can assist you. And so that's really important for everyone to understand, because the Senior Assistance Office actually serves all the seniors, the entire state of Massachusetts. And I know one particular point of pride for them is that even on their busiest weeks, they return all the voicemails that they're unable to answer the moment they call within 1 business day. And that's a huge achievement for them. Kudos to them. They're not listening, but just if I can say it out loud. But it is really, really important that people feel like we are being responsive to their inquiries and that they're able to reach us with good customer service. Next slide, please. I wanted to spend a couple moments sharing with you some federal waivers that the state agency has taken on in collaboration and through approval with the USDA Food and Nutrition Service. One thing that has helped us manage a caseload like the numbers that you just saw on the previous slide is that we currently have the Elder Simplified Application Project. We call it EDSAP in Massachusetts. Nationally, it's referred to as ESAP, and it serves older adults and people with a disability. And this is a really critical waiver and has been exceptionally helpful for us in Massachusetts in maintaining our caseload, especially during COVID, in that it certifies older adults and people with disabilities for 36 months uninterrupted. There's no periodic report. There's no form they need to fill out. The only time they need to contact us is if they begin working or if somebody joins their household. And that's just so that we can screen and make sure that they're still eligible to be certified as an ESAP household. So this is a really big win for the older adult population. It's a win for the state agency as well. And it makes a lot of sense because most of the folks that fall in this certification type have pretty steady income. And so the changes in their circumstances are minimal. This is also a really great tool for reducing churn, like I was talking about before. The second federal waiver that I want to speak about is the standard medical deduction, SMD, as we like to call it. This allows folks to get a standard deduction of $155 so long as their medical expenses are greater than $35. And that is really, really, really critical to folks actually claiming the medical expenses that they ensue at home. And so one thing that's really, really important is that when folks screen, they're not screening, they find out if somebody falls between 35 and 190, and then they advise them on what medical expense documentation they would have had to submit. We in Massachusetts are fortunate that we were able to secure a waiver that allows for families that fall in that medical expense range to self-declare, but they do have to provide verifications for anything greater than 190. There are some challenges, and I want to be really transparent as a state agency in adopting this federal waiver. In particular, state agencies are required to maintain something called cost neutrality, which means if we choose to elect this, we need to make a change somewhere else in our SNAP benefit calculation to ensure that by implementing this change, it's not costing more than it would without it. That's a really hard thing for state agencies to have to overcome. And the other part that is really kind of challenging in terms of claiming medical expenses in general is that the verification process is pretty cumbersome and confusing. Next slide, please. So since there is a subset of our population that are required to submit verifications, and quite honestly, up until this year, everyone was required to in Massachusetts, I wanted to share some verification best practices that we had implemented and we found really helpful. I mentioned the informed interviewing, and that's kind of what I was alluding to when I said if somebody's already at the maximum benefit, we're not going to be screening them thoroughly for all their medical expenses and advising them to get us documents that aren't useful for them. One innovation that I'm really proud of, I really recommend you talk to folks in your state and see if this is applicable, is we realized upon analyzing who was claiming the medical expenses that we had a very low claim rate. It was under 20% of people eligible to claim medical expenses were claiming them. But when we spoke to our counterparts over at the Department of Housing, they shared with us that they had an over 80% rate of claiming of medical expenses. And this is for the same population. And one challenge that people were running into is that it was common knowledge that if you submitted your medical expenses to housing, you would get a reduced rent. And so folks would get all of their documentation together and they would submit it to housing and then have a hard time getting it back. And so one way that we decided to streamline this is we did a cross analysis of the medical expenses that are allowable for housing authorities and for SNAP, and they were pretty much identical. And so we were able to create a policy that allows folks to get a housing computation form, which is kind of a summary of their income and their rent and their expenses. And on that form, it lists the amount of medical expenses that the household is claiming. And so long as that household is comprised entirely of older adults or people with disabilities, we can simply take that number without getting all of the itemized receipts. And that was a big, big game changer. And it was really, really helpful. So I can't apply it enough. I strongly recommend it. I already spoke to you a little bit about how case managers could look up mileage. And then lastly, creating a medical expense brochure that specifically outlines and provides examples of what's allowed to be claimed has been really, really helpful, especially for the over-the-counter medical expenses. We really went out of our way to make sure that it was explicitly clear that these things are considered medical expenses. So please tell us about them because you are paying for them. Next slide, please. I also want to talk just a little bit about the importance of these key partnerships that we've found are essential to reaching older adults and ensuring benefit adequacy. Specifically, our SNAP Outreach Partner Project is one that we do in partnership with USDA to have contracted SNAP Outreach partners. And several years ago, we did a very intentional recruitment roadshow, if you will, and partnered with the Massachusetts Councils on Aging Association, MCOA, and really diligently recruited councils on aging to become as contracted outreach providers. And this allowed us to educate folks on the nuances of SNAP, on the application process. And in Massachusetts, if you're an outreach partner, you have access to a specialized provider portal and a direct point of contact. And so that really streamlines the application and recertification process and supports the folks on the ground doing that work. And so to date, we have over 30 councils on aging as SNAP outreach providers, and it's a really wonderful partnership that I strongly recommend. The other partnership that was really helpful, especially in the ending of the emergency allotments, is the collaboration between us and our sister agency, the Executive Office of Elder Affairs. Predating COVID, we have a data exchange with them where we identified shared households who had a high balance or hadn't used their card in a certain number of days. And they would show up on a report, and case managers at Elder Affairs would incorporate it into their check-ins. And we found that it was really beneficial to do that because a lot of times folks had forgotten they even had SNAP or they had lost their card. And so the case managers were able to help assist them in getting a new card or addressing any transportation issues that they might be having, et cetera, et cetera. Fast forward, excuse me, to this past 2 months when we've been kind of frantically making sure we get the word out to folks about the emergency allotments ending and the importance of letting us know about medical expenses to ensure that they're receiving the accurate benefit amount that they're eligible for. The Elder Affairs Agency has been really, really critical, working with us on text messaging outreach. We did specialized trainings with the councils on aging, even the ones that are not SNAP outreach partners, to explain medical expenses and aid them on how they can assist folks in claiming those expenses. So those those specialized presentations are really, really critical. And we've heard back from the folks that they're very helpful to them. And then lastly, we do have a food security work group across all the different state agencies that are involved in food security work in general, in any way, shape, or form. We meet monthly, and that's also a really great meeting ground because it allowed me a platform. For example, when emergency allotments were ending, I had a centralized group of people who were tapped into the food system who helped reach out to their subsets of population. So, for example, the Department of Higher Ed is a member of the food security work group, so they were able to get the word out to college students or elder affairs, like I talked about, or Medicaid, et cetera. So a really good gathering ground, just that we're all able to stay in touch and kind of lean into each other at a moment's notice. Next slide, please. And the last thing I wanted to talk to you about, I recognize that this is a national presentation, so not everybody has a healthy incentives program, but that USDA is currently accepting applications for their version of a EHIP program. And I strongly recommend it for any state that's considering doing it. It's been a game changer for serving older adults in Massachusetts. So what the Healthy Incentives Program does is it provides money back on purchases made for fresh fruits and vegetables from eligible vendors, specifically farmer markets, farm stands, etc. And one of the unintended benefits of this program is it really turned into a community event. Again, this is mostly pre-COVID, and it's starting to come back in a post-COVID world. But pre-COVID, we saw incredible buy-in from senior centers, and it was combating social isolation. People were looking forward to it. They were re-engaging in their community while consuming healthy foods. And so I just wanted to put in a plug because it was really a great way in Massachusetts for households at the minimum benefit to stretch their dollar and get an additional $40 a month. And so that is the end of my presentation. And I think I'm passing it on. Thank you.
Right. Thank you. That was very informative. Hopefully y'all can see me. This is Amy Dearland from California.
We
Is
can
that
see
correct?
you. Go ahead. Yes.
Okay, great. I just can't see myself, so sorry. That's okay. Thanks. So I am coming from a CBO nonprofit here in California, Northern California. And here in California, we do SNAP, which is called CalFresh here, by county. It's run by each county, not by there's obviously the state has oversight, but each county has their own processes. And so what I'm going to share with you today is a little bit about my experience being a CBO, kind of that I'm an authorized rep, which was just mentioned in the last presentation, but I have limited access. So I'm an advocate on everybody's case that we work with. And they do sign a separate release that has to be turned in to the county, and then I'm listed on the case for a year, which is huge. So I just kind of want to explain my role a little bit. So my experience is more working within our county because that's our partner, and we are a application assister agency with our county, and we have a contract, and then we have the relationship where we have access to a specific agency key code to get into the system. And then the county can see, and I believe the state too can see all the applications and work that we do in the county system. So that's a little bit about my role. And I have a group of 4 of us that work out in the community. So I'm going to be talking a little bit about California, and then a little bit about our county and our work in approaching seniors and working with seniors. Next slide. So just to let you know, it's already been talked about, but I want to mention again, here in California, in 2017, we did create that standard medical deduction that's been talked about of $120 for any senior or disabled person. And disabled person, it's not only children. I run into disabled people, youth, young adults, and adults before up until the age of 60. I mean, you can be disabled your entire life, but I want to make it clear that when we're talking about disabled people, it's of any age. And you do need to verify that 35.01, that's what we're looking at, or more in out-of-pocket medical costs. If someone does have more than 155, it calculates out to more than 155 per month, then we do include that. I've worked with folks, they are spending 175. And so they will get the deduction, and it will be a little bit more. So in any case, just wanted to make that real clear. That's already been talked about. So next slide. So before we even go out and talk to people, we need to know medical deductions really well as outreach workers and as assisters and advocates. So I am going to go through the medical deductions in a little more detail because I really train my staff and volunteers in these so they can then talk to folks and help explain what they are, because not everybody thinks about medical deductions. They only think of a certain type. So the medical co-payments for a doctor or specialist. So I talk about with people, you know, are you seeing your doctor at all? Are you having to pay anything to go see specialists that maybe aren't your primary doctor? Is there any kind of type of copay? Just making sure they understand it's just beyond their own primary doctor. Hospital bills, are they paying off any hospital bills? Do they have any outpatient treatment bills that they're handling, like physical therapy or anything related to outpatient treatment that they're having to pay? Prescriptions and over-the-counter prescriptions. So both kind of your regular prescriptions that you get from the pharmacist, as well as those that are prescribed that you would pick off the counter. And so a lot of this language is really trying to get it more into a user's frame of mind of what we're talking about. So sometimes it takes time to explain these things to folks, what we're talking about when we mention it, because we're trying to find as many medical expenses as possible when we're doing this. Health insurance premiums, usually they're monthly. They're usually supplementing their Medicare coverage. And so there's usually there's supplemental health insurance costs that people are incurring every month. With Medicare, I want to mention that often that shows up in their Social Security award letter. So they often have to go to Social Security and get that. And so we help with doing that as well, helping them get to Social Security and getting those letters. Share of costs for Medicare and or Medicaid, which is what we've talked about as well. Alternative medicine, your acupuncture, chiropractor, and herbal treatments. Next slide. So again, going through the list, because it's quite a list: medical or healthcare supplies, incontinence, compression socks, diabetic needles. I run through all possible things that could be in this category. Medical equipment, you know, your wheelchairs, your machines, walkers, if it's rented or paid for. Eyeglasses, contact lenses that are prescribed, hearing aids, prosthetics, dental bills, anything dental related. They don't think of that as medical sometimes. So we talk about that. Cost of transportation. This one is a little tricky, as was mentioned before. Here in this state, it is whatever was the least expensive. So sometimes that's public versus private, but I do help people talk about that. I just had a gal that had, she had to hire somebody to take her to all her appointments, and they were multiple appointments every week. So we wrote an affidavit and talked about what that was costing her each month. And that was used as a verification. Cost of home health aides, anybody that's helping in the home, service animal costs, including toys, food, vet bills, anything related to having that service animal. And then any other medical expenses that are not on our list that you can think of that are medically related. We go over that as well. Next slide. So just wanting to make sure that monthly costs are calculated correctly. It doesn't have to be something that they pay every month. It can be something that's quarterly. Often I find people are paying for their prescriptions quarterly. So we talk about that, and then we divide that by 3 because we're coming up with what's getting to a monthly amount of over 35. And then obviously if it's annual or semi-annual, we're going to divide that by 12 or 6. But all of those come into play, and it has to be fairly recent. And so the whole total needs to average out to more than $35 a month. Just wanted to explain that. Next slide. So how to address people, how to talk to seniors about all this. Next slide. So these are some tips we found. Explaining that this can really make a difference. Sometimes it makes the difference whether someone's eligible or not. And we have the state formula on our computer. So we're able to kind of see by putting in their numbers if they're going to be very likely eligible or not. So making a big point of that, offering to help to gather the information. So offering to go over the form that we have for that and going over all the different categories. And this does take time. So, you know, you've got to know that you're going to be sitting with the senior for a while to go over all this. And then the other piece we do is we help to get verifications. So we explain how we might be able to get evidence. An example would be if I ask where are they getting their prescriptions. Oh, they say CVS or Walmart. I say you can go back there and ask for a statement, and they can run any kind of statement for any kind of length of time. So that's one example, but we talk about helping people get their verifications in order, or doing affidavits, which we do a lot of. Next slide. And then just making sure that they're being counted correctly by the county as well. It's one thing for us to gather all the information, then we want to take that information and turn it in a really clear, concise way for county workers, because we have a variety of county workers. Some are new, some are old as far as, you know, in experience and whatnot. So we make sure that the list is in an easy format for the worker to be able to understand and read and be able to work with. We often will suggest either us or the customer to call the county, make sure they got it, and do they have any questions, and kind of explain to the county worker, here's what we're talking about, to make sure. And then making sure that they're adding it and calculating it, correcting and getting the maximum standard medical, or getting the maximum deduction under that category. And then if the customer incurs any other medically related expense, you know, come back, we can always turn that in and see if that makes a difference in getting even more benefits. It's not just a one-time deal at the point of application. You know, this is ongoing. So really wanted to make that clear too. So those are just some of the tips we found in working with people. Would be happy to talk to anybody online or whatever over the phone about more ways to work with this population. And the last slide is just me and my information. So yeah, thank you.
Thank you, Amy, and thank you, everyone. We're going to close up our PowerPoint. Our panelists are going to go back in. We know that our chat has been pretty active. I just want to clarify a couple of things. The SNAP program looks very different depending on state. I know that Brittany used a lot of words like waivers and options. The best way I can describe it is like you're sitting in a restaurant and they give you a menu, and then you get to pick what those options are, right? Maybe it's not the best way, but just sort of think about that. This is a federal program with a lot of regulations, and each state decides how to avail themselves of some of those regulations and how to make those options and waivers more flexible. The other thing I want to say is, yes, you will get a recording of this. You will get the PowerPoints and any resources we make. The third thing I want to say is, thanks to AARP, we can offer some TA hours, teaching, you know, some support. So I saw some of you put it in there like, that will be great for our state. Our contact information will be on our follow-up email, and I'll also make sure that some of my team members will put in their contact info there as well. Send us an email and we'll set up some time so that we can discuss it about some of the things that you heard today that, you know, you might want to see what the pathway is to implement it in your state. And you also notice that like California has some different things, and Massachusetts had some different things, and Kentucky's had some different things. Again, because state does things a little bit differently. And I know that everyone's really grateful for all of you and participating. So one of the questions that came out of this, I was taking pictures this year, going through the chat. But one of the questions that I wanted to just say to everyone here to start us off is, Brittany, you mentioned that, you know, you do a lot of, you speak with a lot of task holders, you speak with a lot of partnerships. You know, what I just mentioned, like, you know, each state does it differently. What is the best way for states, for nonprofits, for organizations to reach out to their own state agency with the understanding that some of them are by counties, to develop a relationship and to give feedback on some of the ways and the issues that are seeing to make things more accessible? Because I know that, you know, Massachusetts has an amazing thing, but I also know you guys have a really strong advocate base that you work really closely with. So if you can sort of set the stage, we'll start with that.
We do have a very strong advocate base, but I think the most critical thing is that we actually genuinely do view it as a partnership. And that doesn't mean we always agree 100%. A healthy debate is always good. But we inform each other. We look to strengthen the products that we put together, and we do collaborate. And so, you know, when I was talking earlier about some of the challenges of the waivers, I have a lot of empathy for my fellow counterparts in other states, because they can only operate with what they can operate with. And so one opportunity, though, is to thoroughly and partner with entities that don't have the same kind of other funding restrictions or others. So the SNAP Outreach Partner project is a really critical and awesome tool to do that. I talked a little bit earlier about the intentional partnering that we did with the Councils on Aging. And so one step be to, if you're unfamiliar with what the SNAP Outreach program looks like in your state, or if your state's even doing it, not every state does it, it may be worth it to kind of take the temperature of your state at that point. And then, you know, connective tissue is really, really important. And so I'm not disingenuous when I say that we view our partners as an extension of our agency. It's why we created special portals for them. And because the more trained up they are, the better they understand our rules, our processes, everything, the better product that we get at the agency, and it's a better outcome for the individuals and families that we serve. And so that's one way, is to just kind of take inventory and say, does my state have a contracted SNAP outreach provider project? And what that means, just for those folks who are unfamiliar with it, is that folks who participate in that project, USDA will refund up to 50% of their expenses that they use on SNAP outreach. They'll get like a reimbursement. So that project is really critical. So taking some task in terms of what your state's doing, and then seeing if there's ways that you can help spread the word or collaborate with them on that, and broaden the network and extension of your reach, is a really great way to lean into existing infrastructures and organizations.
Thank you. And Jackie, there were quite a lot of individuals who appreciated the data, people who are not claiming those deductions. So I'm gonna, you know, all of you share like very broad sort of questions around, you know, what are the sort of the best practices, and if you all can just share one of the sentences, because it really does seem like it's a plethora of individuals, and AARP is usually not seen as a player in this group. But how would you see as AARP and similar organizations playing a role in helping individuals claim disability?
Well, we've found that there is a lot of misinformation around the SNAP program, and one of the great barriers is people thinking that they're not eligible, or that the deductions or the program itself don't apply to them. That they might think that they're taking away benefits from other people if they enroll. And so I think that a really great outreach opportunity, which means anyone on this call, is helping to remove that misinformation that might be preventing people from taking access to these benefits that really can support them and are not taking benefits from other people.
Thank you, Jackie. Amy, do you want to add anything?
Yeah, just to say, my experience is people could get pretty overwhelmed with paperwork and or trying to put this together, and governments they shy away from. So just a lot of patience. I talked to a lot of seniors. They're lonely, as somebody mentioned. How many households are single? They want to talk, but having the patience to go through this, as well as to simplify it, you know, trying to help them understand the government jargon that is out there and not get overwhelmed by the paperwork, because that's what often just people just decide they're not going to want to do it. Yeah, they give up.
Yeah, thank you. And this is where, you know, depending on what options and waivers can do. And I know, Brittany, you mentioned a couple of things, the improved SNAP application for older adults. I know that Massachusetts also has an online application that automatically tabulates the mileage for individuals so that they can claim it. And that is just amazing. And one of the questions here, Brittany, so that you can answer it for folks, is how do you make sure that, for example, for this senior application, for the people calling into the, I'm using the term because that's the way they utilize it. I know we use the term older adult, for the assistance unit, how do you make sure that, you know, if I'm calling in, how do you make sure that, you know, individuals who don't fit this category are sort of being filtered out from accessing these things?
If I think I'm understanding the question correctly, we did a lot of coding in our system. And so we have indicators to say whether or not somebody's case is tethered to the senior assistance office or the broader case management application pool. And then we kind of, did soft talking points as well. What we were very concerned about at the beginning was people using this as like a backdoor entrance to get out. Like, there's a wait on the regular assistance line, and that undermines all of the work we're trying to do if we jam up this new line with people who aren't, that it's not designed to serve for. So we did some coaching too in that regards, and they can transfer them back into the regular assistance line. But quite honestly, we've had this office open since 2018 and I personally haven't heard tremendous amounts of issues of people going, wow, we're getting slammed with non-older adults.
So I want to just highlight something you said, coding, because I know as a state advocate, anytime we would go to Brittany with many ideas back in my other role, she would be like, it sounds simple as an advocate, but there's like this coding and technology and IT. And I do want to flag that a lot of these county and state agencies, their systems are not as up to date as others may be. So just keep at it, develop those relationships. And if your state agency or your county agency is telling you no, just sort of ask the reasons why, because I know a lot of the times it's this computer the technology that it takes and the different stuff. Just really quickly, because I see we're running out of time. You can submit medical expenses at any time, right? Because this is an increase. I just want to flag that for individuals. I also want to flag that. Thank you, Amy, for spending time mentioning like different medical expenses. It's a case by case scenario. Like the federal regulations just say, but there are certain things you can do. I'll give you a quick, but just it just depends on the situation if it's medically related for that person, right? So it's case by case. And that's why I said we'll have TA hours that we can assist with. And, because we work nationally, we also can see what are some of the best practices some other states are doing. So feel free to reach out to us and some of the work that we've seen that other states are really leading the way to make your job a little bit easier. The other sort of questions, we talked about, they can report at any time. And I did mention that we will go ahead and submit these as a follow-up email. And we have run out of time, but I just want to give our panelists a few seconds in case they want to have any closing remarks. And it's okay if you don't. I didn't mean to put you on the spot.
I can go. Thank you, Gina. I love getting up here and getting to talk about what we in Massachusetts have been able to achieve. But I also want to just put my own little state agency hat on too, and just say this is super hard times for all of my counterparts. So go gentle on us. Even if they love your ideas, they might not be able to implement them right this moment. To Gina's point, before I went to the state, I was the queen of being like, can't you just add this to a notice? And now I work at the state. I'm like, oh, you can't just add that to a notice. So I would be disingenuous if I didn't. For my friends sitting in my seat, honor what they are trying to balance right now, and they might really love your ideas. So not now doesn't mean no.
That's a great reminder, Brittany. I think my closing remark is, we have all of this great data that talks about who older adults are that are leaving benefits on the table. And we are always looking for partnerships, whether that be research or outreach pilots that we can test out to figure out who are these people that are leaving substantial benefits on the table and how can we help assist them. If you have ideas, you can always reach out to me. I think our names are included in the contact information, but we'd love to hear your thoughts.
Just thanks for allowing me to share a little bit about what we do here in Northern California. I love working with seniors. Has been a priority population for me for many years, and reaching out and working with them, as you all know, it can take some patience and time, but in the end, they benefit having more food in their homes and to eat. So it's worth it.
Thank you. And I'll just remind individuals that with the emergency allotments ending, you're going to see older adults who still haven't received the message that this happened, regardless of how much outreach has been done. So definitely talk about ways that they can ensure benefit adequacy as their benefit goes down to the minimum, because every penny really does count for this population. I want to thank all of you for attending. I want to thank our panelists, and we will follow up with an email. Have a wonderful day, people.